Welcome to our channel. Today, we're going to cover a topic that may surprise many of you. We often hear about natural remedies, supplements, and even prescription drugs being praised for their incredible health benefits. But did you know that some of these wonder treatments can actually contribute to cognitive decline and increase the risk of dementia? Before we begin, don't forget to subscribe to our channel and hit the notification bell so you never miss an important update on your health. Segment 1: Anticholinergic Medications. First on our list are anticholinergic medications. These drugs are commonly prescribed for a wide range of conditions, including allergies, depression, overactive bladder, and even sleep disorders. While they can be very effective for managing these issues, there's a hidden risk that comes with long-term use. Anticholinergics work by blocking a neurotransmitter called acetylcholine, which plays a key role in transmitting signals in the brain and nervous system. Acetylcholine is particularly important for memory and learning, which is why these drugs are linked to cognitive decline. Research has shown that long-term use of anticholinergics can increase the risk of dementia, particularly in older adults. The effects can accumulate over time, especially if you're taking multiple medications that have anticholinergic properties. This is why it's crucial to regularly review your medications with your healthcare provider, especially as you age. If you're currently using anticholinergic medications, don't panic, but do take action. Talk to your doctor about possible alternatives, or explore ways to reduce your dosage safely. Protecting your cognitive health is just as important as managing the conditions these medications treat. Segment 2: Benzodiazepines. Next up are benzodiazepines, a class of drugs commonly prescribed for anxiety, insomnia, and seizures. These medications, often known by names like Valium, Xanax, and Ativan, are widely used for their calming and sedative effects. But there's a significant downside, especially when used long-term. Benzodiazepines work by enhancing the effect of a neurotransmitter called gamma-aminobutyric acid, GABA, which slows down brain activity. This is what makes them effective for calming anxiety and inducing sleep. However, by slowing down brain activity, benzodiazepines can also impair cognitive functions like memory, attention, and problem-solving skills. Studies have shown that prolonged use of benzodiazepines, particularly in older adults, is associated with an increased risk of dementia. The sedative effects can lead to cognitive decline, and when combined with the natural aging process, the risks are even higher. What's concerning is that many people continue using benzodiazepines for years, sometimes even decades, without fully understanding the potential long-term impact on their brain health. If you've been prescribed benzodiazepines, it's crucial to use them only as directed and to explore alternative treatments for anxiety or insomnia that may pose less risk to your cognitive health. Remember, managing anxiety or insomnia is important, but so is protecting your brain from potential harm. Always discuss the risks and benefits of benzodiazepines with your healthcare provider, especially if you've been using them long-term. Segment 3: Statins. Now let's talk about statins, the cholesterol-lowering drugs prescribed to millions of people worldwide to help reduce the risk of heart attacks and strokes. While statins like Lipitor, Crestor, and Zocor are effective in lowering bad LDL cholesterol, there's growing concern about their potential impact on brain health. Statins work by inhibiting an enzyme in the liver responsible for producing cholesterol. This is crucial for heart health, but cholesterol is also essential for brain function, particularly in the maintenance of cell membranes and the production of neurotransmitters. Some studies have raised concerns that long-term use of statins, particularly at high doses, may be linked to an increased risk of cognitive decline and dementia. This is because cholesterol is vital for the brain, and reducing its levels too much could potentially interfere with cognitive functions such as memory and learning. However, the research on this topic is still evolving, and the evidence is not yet conclusive. Some studies suggest that statins might protect against dementia, while others point to a potential risk. The key takeaway here is that statins should be used cautiously, especially in older adults and those at risk of cognitive impairment. If you're on statins and are concerned about your memory or cognitive function, it's essential to discuss this with your healthcare provider. They might suggest a lower dose, alternative cholesterol-lowering strategies, or additional monitoring of your cognitive health. Segment 4: Proton Pump Inhibitors, PPIs. Next up, let's dive into proton pump inhibitors, or PPIs for short. These medications, such as omeprazole, Prilosec, esomeprazole, Nexium, and lansoprazole, Prevacid, are commonly prescribed to treat acid reflux, heartburn, and GERD by reducing the production of stomach acid. While PPIs are highly effective at managing these symptoms, there's growing concern that long-term use may be linked to an increased risk of dementia. But how does a drug that targets your stomach potentially affect your brain? One theory is that PPIs might affect dementia risk by altering the absorption of certain nutrients vital for brain health, such as vitamin B12. Vitamin B12 deficiency has been associated with cognitive decline, and since PPIs reduce stomach acid, they can also impair the absorption of this crucial vitamin. Additionally, PPIs have been shown to cross the blood-brain barrier, where they might interfere with the production or degradation of beta-amyloid, a protein associated with Alzheimer's disease. While this connection is still being studied, it raises important questions about the long-term safety of these drugs. It's important to note that the evidence linking PPIs to dementia is not conclusive, and many people use these medications without any cognitive issues. However, if you're taking PPIs regularly, especially for an extended period, it might be worth discussing with your healthcare provider whether they're still necessary or if there are alternative treatments available. Remember, while managing acid reflux is important, it's equally crucial to consider the potential long-term effects on your overall health, including your cognitive function. Segment 5: Antihistamines. Moving on, let's discuss antihistamines, which are widely used to treat allergies, colds, and other conditions. These medications, like diphenhydramine, Benadryl, loratadine, Claritin, and cetirizine, Zyrtec, work by blocking histamine, a substance in your body that causes allergic symptoms. Antihistamines are incredibly effective for managing symptoms like sneezing, itching, and runny nose. However, some research suggests that the regular use of certain antihistamines, particularly the older first-generation types like diphenhydramine, may be associated with an increased risk of dementia. So, how might antihistamines contribute to cognitive decline? One explanation lies in their anticholinergic properties. Anticholinergic drugs block the action of acetylcholine, a neurotransmitter crucial for learning, memory, and other cognitive functions. When acetylcholine is blocked, it can lead to confusion, memory issues, and even an increased risk of dementia, especially with long-term use. Studies have found that older adults who use these anticholinergic antihistamines regularly may be at a higher risk of developing dementia compared to those who don't. This doesn't mean you should avoid them completely, but it does mean you should be mindful of their use, especially if you're using them frequently or for extended periods. If you rely on antihistamines for allergy relief, consider discussing with your doctor whether a newer, non-anticholinergic option might be safer for you. Non-drowsy antihistamines like loratadine and cetirizine typically have fewer anticholinergic effects, making them a potentially safer choice for long-term use. Remember, it's not just about managing your allergy symptoms today, but also about protecting your cognitive health in the long run. Thanks for watching. It's essential to stay informed about the potential risks associated with any treatment you're using, even those that seem beneficial. If you have any concerns about your medications or supplements, always consult with a healthcare professional. Remember, your health is your most valuable asset. Don't forget to like this